My name is DhawalGusain, and as a part of my project in ECE561, I'm presenting my literature survey on evolving role of electronics in biomedical. So the overview of this presentation is as follows. First, I'll discuss what exactly biomedical means. Then I'll go over the role of electronics in biomedical. Um, we'll later discuss the design challenges presented by biomedical, and then see some of the innovative solutions that have come over the period of time. At the end, I'd like to discuss the future of biomedical field and some of the further work that could have been done in this present literature survey. Biomedical. Biomedical essentially means it's a science that's responsible for design concepts of medical and biology in healthcare and for both diagnostic and therapeutic use. It's majorly classified as genetic engineering, pharmaceutical engineering, medical devices, implants, and bionics. So, the role of electronics in biomedical. About a century ago, there were only three equipments that were available to the physicians at that time. There was stethoscope, electrocardiogram, and X-rays. But now, with the advancement in the field of biomedical and the involvement of electronics, there are many breakthrough technologies which have come up. These are like genetic sequencing, image guided surgery, endoscopy, computer assisted tomography, that's CAT scan, food engineering, heart valve replacement, and so forth. A very important thing which has been brought in by electronics is the portability, miniaturization, connectivity, and humanization of the biomedical devices, which is very critical as these devices are used by patients, which are human beings, of course. So let's discuss the design challenges presented. For the design of these electronic goods, electronic items, they should be very comfortable to wear, stretchable, extremely low power, and they should have the capability for energy harvesting because they operate within the body of a human being. Also, keeping in view the patient's profile is very important because every person is different from others and they have a different immune system. So in this, machine learning algorithms play a very critical role. Also, the wires which are designed to connect these circuits should be able to withstand elongation with a minimum change of resistance. Otherwise, it would lead to a different circuit property, which is not advisable. For fabricating such chips, there's a technology called cycloolefin polymer, which is used, and this should be very low cost. Also, the transistor technology used should have very low noise, power, and very good dynamic range. An important example being a bi-CMOS, which is a combination of both bipolar and CMOS transistors. So after looking at the design challenges, let's look at some of the innovative solutions proposed. The first solution I present is an e-pill, SoC-based electronic pill with 32-bit series processor and capable of bidirectional communication at 115 kilohertz. This is basically a low-cost, practical, non-intrusive device which is helpful in identifying GI tract diseases. The medical practitioner can diagnose the disease, check out information, and then administer precise dose. A similar device is a low power bionic pancreas which is capable of delivering insulin. It's classified into open loop and closed loop, with closed loop being better in providing better results. So this device consists of an insulin sensor for detecting sugar level and an injection pump for injecting the insulin. The next device I discuss is a MEMS-based polymerase chain reaction device known as biochip, and this is capable of having different reactions in this body without any variations in temperature. Telemedicine is a very important field in biomedical as it helps in real-time monitoring of the patients. So the paper discussed a couple of devices like SLPS and Agalea, SLEPS is a wearable system which helps in a real-time rescue by monitoring the important parameters of the body. Agilia is a non-invasive device which continuously monitors the breathing function and gives out a detail to the nearest hospital. The The next device I discuss is very helpful for epilepsy patients as it helps in seizure detection and simultaneous drugs injection. So the device consists of 12 electrodes which are mapped to the brain, and they detect seizure and help in simultaneous drug delivery. This device is asynchronous in nature to reduce power consumption. Nano drug delivery is a method in which the drug delivered navigates around the immune system and helps in effective control of the disease. And the last device I discussed is a photoacoustic imaging, which is used for detecting anomalies in soft tissues and blood vessels with a high spatial resolution and is non-ionizing in nature. So this is much more famous than normal MRI and CAT scan. Here's a look at the pictorial depiction of some of the biomedical devices which I went through in my literature survey. And in the last part of my presentation, I will discuss the future role of biomedical and how it will evolve. So with the rise in the aging population in different countries, both the healthcare costs and the reachability of healthcare is increasing, and this needs to be provided at a very reasonable cost. So there are many researches which are going on in different parts of the world, uh, majorly focusing on oral sensation and visual prosthesis so that people who can't see or hear can be provided with this capability. Also, a lot of work is being done for nuclear and molecular medicine so that the biological characterization at the cellular can be level can be understood and drugs be administered to the patients accordingly. PACS, which stands for Picture Archiving and a Communication System, is a medical technology which provides access to all the medical practitioners and doctors on the information regarding patients, and they can uh, diagnose on the basis of this information. Also, a very innovative field is remote surgery, wherein the surgeon remotely operates on a patient from a robotic arm, and this holds a lot of promise in future. IBM have designed a supercomputer known as Watson, which is capable of answering questions relating to diagnosis, symptoms, and different things. This uses advanced artificial intelligence algorithms. Regeneration and damaged spinal cord and brain might be cured in future as there is several research going on this area. And it may be also possible in future that you could replace your entire joint, entire heart transplant or lenses in the day. Also, with the evolvement of tissue engineering, diseases like Parkinson's, dementia, and essential tumor can be reversed in future. So some of the further works which I didn't cover in this literature survey can be like studying on the acceptability of these biomedical implants as they cater to human beings, and there should be no acceptability amongst them. Also, the electronics involved should gracefully degrade it over a period of time so that there are no harmful effects on human beings. The prosthetic limbs which are present are quite nascent in stage, and they can be evolved in the sense that they can be directly controlled by the brain and completely integrated into the body. Also, a major concern with these devices is security and reliability, so that the information of a patient doesn't leak out or cannot be, take cannot be utilized in a harmful way for him. So this is all from my side. Thank you.